HRT or HRT is something that, again, we don't tend to talk much about, but is a really
hormone replacement therapy.
Hormone replacement therapy. It's a really important thing to open up a conversation around, because it's one of the number one treatments to ameliorate a lot of these symptoms in women who are eligible and who want to, and including things like bone mineral density loss and heart disease risk as well. And I think there's a lost generation of women who felt that it was too dangerous to even consider HRT. And in those women, I think, there's a huge injustice that has been done there, because HRT as a hormone replacement model is a great way to ease that hormonal transition. Rather than going through all those fluctuations, you're replacing a lot of the hormones that you would have otherwise lost, and you're maintaining your bone mineral density. You can improve a lot of the bone ache issues. You're actually reducing potentially your risk of heart disease as well. But there is a window of opportunity with regard to heart disease risk. And that's like around the menopause. Like if you're within 10 years of menopause or less than the age of 60, that would be a good time to reduce your risk of heart disease moving on in life. And the same with the bone mineral density loss. There's that window of opportunity there in that sort of 5 to 10 year window between sort of 45, 50, 55, where if you are eligible, it's worth at least exploring the idea of HRT.
Right. Okay, so with that in mind, then wait, hold on a second. Let me collect my thoughts before I start.
We were talking about HRT, weren't we?
Right. So with that in mind, how safe or unsafe is HRT in general now? And what are the factors that determine whether a woman is a good candidate for this?
Yeah, so there will be certain women that are not eligible for HRT, primarily those who've experienced breast cancer. But there are other potential reasons why they wouldn't want to have HRT as well. Obvious things like pregnancy or a recent blood clot or an undiagnosed bleed, for example. But in actual fact, I would say, excluding those women, most women would be pretty good candidates for HRT. The main problem that really scared a lot of women back in sort of 2002 was the Women's Health Initiative study, which showed that there was a potential increased risk of breast cancer. In fact, the study was halted early over concerns about excess breast cancer risk. And unfortunately, the headlines around that study went around the globe and made the use of HRT drop by about 66%.
In other words, the headlines being something along the lines of HRT will cause breast cancer.
Yeah, exactly. And it scared everyone. It scared doctors. It scared women who were taking HRT. So many women stopped taking it. But interestingly, Professor Langer, who was one of the main investigators as part of the study, wrote a paper condemning the headline of the study as being irresponsible and wholly inaccurate. And many of the lead investigators on that study were not consulted before it was even published. And one of the main problems with the study was that they used women aged 65 or thereabouts, and they were starting HRT brand new. And of course, by that stage, a lot of those risk factors for breast cancer and excess risk of heart disease, for example, were already in existence before they began the treatment. And I do believe it's let down a whole generation of women. There was a really interesting study in the BMJ from 2012 that showed that if you take HRT for a period of 5 years, you actually have reduced risk of heart attacks and heart failure. There was no increased risk of breast cancer or blood clots at all. And there was an interesting study by David Katz, actually, in 2013. And he estimated that in the 20 years after 2002, that there were anywhere between around 20 to 90,000 women who died prematurely from not having access to HRT because of the protection it can offer for heart disease and bone mineral density loss, as well as obviously all of the other symptoms that we've talked about, with the flushing and the mood changes and the way the vaginal atrophy and the way that these things can impact their lives day to day.
And the optimal time to begin HRT would be early in menopause, right? Before you've already suffered bone loss and all these other ramifications.
Yeah. And the age of menopause does vary. the average age is about 51, but it's normal for it to start anywhere between ages sort of 45 to 55. And I think it's actually vital to think about, if you're going to think about starting it then, because you are preventing, it's a prevention, isn't it? So you're preventing the bone mineral density loss, you're preventing the atherosclerotic plaques that we start forming because of the lack of estrogen in the body and how that's cardioprotective. And it's a way of then, essentially lengthening your time where you're sort of functional and you're not having some of these problems.
Mm-hmm, mm-hmm.
Yeah.
And what is the composition, what is the hormonal composition of HRT?
So it's basically a combination of estrogen and progesterone. Interestingly, if you have estrogen-only HRT, then there's absolutely no excess risk of breast cancer at all. But the reason that progesterone is often added is to help protect the womb lining. Because if you have a normal womb and you just give unopposed oral estrogen, then you could have excess risk of bleeding and increased risk of endometrial cancer, which is why progesterone is given in combination with the estrogen replacement. But if you look at, there's loads of different types and formulations of HRT. But I do want to stress that if you're going for like the gold standard, which would be an estrogen gel or an estrogen patch alongside micronized progesterone, then taking that for about 5 years, there was a systematic review to say that there was absolutely no increased risk of breast cancer at all. So I'd love for women to know that if they want to look into it, they should. It comes, as I say, in the form of patches, gels, tablets, there's loads of different brands, but essentially it's just estrogen and progesterone.
Mm-hmm. And what percentage of women currently are on HRT? Is it a low percentage?
It's low and it's increasing gradually. I think it was probably at its lowest just after the 2002 study. It's gradually creeping up. There's a lot more awareness now about menopause and the symptoms, especially in the UK. I don't know if that's translated over here in such a big way, but I get lots more women coming to me in clinic asking about HRT, which I'm really pleased about, because so many women over the years have said, "Oh, it's not natural, it's not for me, and it's harmful. I'm worried about breast cancer." And I want women to know that it's a very valid option, and it's actually it's the menopause guidelines suggest that it's the number one treatment for bone mineral density loss, as I mentioned.
Yeah, you mentioned the word natural. There is an interesting thing within wellness and holistic health circles that, obviously are going to prioritize natural remedies, food is medicine, et cetera, at the cost of medical interventions that could be helpful, right? So there's a weird, in the Venn diagram between evidence-based medicine and, lifestyle protocols and the kind of organic wellness, alternative, holistic health. I could see a tension between those two things. Like somebody who's like, well, I'm just going to eat organic food. You're saying, yes, but this intervention could be beneficial, but hey, that's not really part of my protocol. I'm trying to not be on any kind of exogenous interventions.
Yeah. And that's something that I respect. If someone doesn't want to take extra hormones, then they shouldn't have to. And I completely understand that perspective. I think what bothers me is the idea that the choice of women is often taken away because of unfounded fears. And I think for me, it's important to be able to offer something that could benefit. And whether women want to have it or not is up to them. But we have to consider what's really natural, I guess, in the environment that we're currently living in. I mean, you could say it's natural to die in childbirth, because if you're in Afghanistan and you're in a village somewhere,
Sure.
You've got about a 1 in 14 chance of dying from childbirth. Is that natural? Yes, I suppose it is, but it's clearly not something that anybody would wish to happen. And so I think, when it comes to severe menopausal symptoms, but also longevity, I want to be able to provide women with every possible option that is deemed to be healthy and appropriate. And if they want to take it, they can.
Right. You mentioned earlier that the age at which young women are experiencing their period is getting earlier and earlier. Is there also a change in the window for menopause? Is that happening earlier also?
No, so I think it may be again a reflection of Western society and the various exposures that we have, but menopause in some cultures is actually seemingly getting a bit later. There is some potential genetic differences as well. Afro-American women will potentially, African, should I say? I don't know what you say here. African-American,
Black women.
There are some potential genetic differences in when you would start the menopause anyway. So, for example, Black women may find that they start their periods on average at about 48, 49, whereas white women may start on average about 50, 51. But yeah, I think menopause can vary based on diet as well. There was an interesting study to show that eating more vegetables could potentially bring the age of menopause slightly younger. Again, not dramatically, like maybe 3 months on average. They were looking at sort of large population data. But I think that's very interesting because, again, it speaks to the effect that our diets can have on our normal physiological processes.
Is there a mode of eating or particular foods that could lessen some of the negative symptomology around it?
Absolutely. And I'd say, again, I'm going to bang on about fiber. Fiber is crucial. And soy, minimally processed soy products are really beneficial as well. Making sure that you have a nice variety of things like nuts and seeds for extra minerals like selenium are important. Even sort of things like, I know we haven't touched on thyroid function, but again, that's another hormonally regulated organ. You want to be able to make sure that you're having great sources of iodine, selenium, zinc, and that's true for all of the hormones in the body, but especially for things like the thyroid.
And what are some of your favorite foods that are high in those things?
So with selenium, you could just have like a Brazil nut a day. That would be pretty good. Yeah. But it's also in whole grains, whole grain rice, whole grain bread, other nuts and seeds, and the same with zinc as well, which again is important for things like sperm production. I know we're not talking about men, but sperm production.
We're going to get to that.
Yeah, so there are loads of great foods. So just think fruits, veggies, whole grains, beans, soy products. I'm a big fan of flax seeds just because they're great at helping to improve the suppleness of blood vessels. And they've got loads of great omega-3s from plant sources as well.
Just make sure you grind them first.
Otherwise
they pass right through.
Yeah, exactly.
Let's talk about male hormonal health. Is menopause like a real thing? And also, I'm interested in your thoughts on TRT because it's obviously the other side of that coin.
Yeah, so I think that for men, I don't have personal experience of this, but certainly with my patients, it doesn't seem to be as much of a thing for men as for women. And I mentioned earlier, I think it's because it's a very gradual decline. Like with most of the hormones in our body, testosterone production can start to wane over time. So, I think in certain conditions it might be beneficial for testosterone replacement, but I don't see it as being something as vital for male health as estrogen replacement would be for female health, based on the changes in the body that occur for women that just simply don't occur for men.
Yeah. I know so many guys my age that are on testosterone therapy. I'm not, but they talk about it. It's something that guys of my age, tend to, are you doing that? Should I do that? Should I not do that? Are there negative health outcomes with respect to that? My understanding is that if you get on it, then that's it. You have to stay on it because obviously if you're taking it exogenously, then it's going to shut down your body's, whatever your body is making, right? Like it's telling your body, like, you don't need to make any of this because you're getting it.
Yeah, I think this is where men should be cautious and speak to their own doctors about whether it's necessary or not, especially if you're somebody that is actually hoping to perhaps father a child at any time. Because like you say, you're turning off your own testosterone production there, whatever it, is still going on. And that can have ramifications for your fertility. So I think that would probably be the main consideration, depending on the intentions of the person that wants to take testosterone replacement, just to think carefully about if it could actually impact their fertility. But yeah, I think
most guys my age are they're not worried about that part.
Yeah, probably
actually
not.
They want the opposite. Not everyone, but
yeah. So yeah, it's not something that is as prevalent, or indeed I don't believe as necessary for men as it is for women. but it's a conversation that I think is occurring a lot more in wellness
what would be the
spaces.
reason for doing it?
Probably to increase things like muscle mass, mood changes sometimes that can occur in men as the testosterone levels that you're endogenously producing fall. I think one of the main reasons that my patients would go on testosterone replacement is if they have excess estrogen exposures. So it tends to happen more when men are carrying excess weight as well. That because, as I mentioned before, the fat cells can produce estrogen, which can have perhaps a slight feminizing effect. So yeah.